I'm Dr. Sharat Kumar, consultant orthopedic surgeon. We have with us Mr. Mukhtar. He is 53-year-old. He presented with stiff hips, both stiff hips, and he had difficulty walking, and he presented with abnormal gait. He had problem about 31 years ago. He had infection affecting both the hip joints, resulting in fusion of both the hips, and since then he has been suffering with this disability. X-ray showed a complete fusion of both the hip joints, and the only solution to bring the movement was joint replacement surgery, which was performed first we have done on the right side, and after on 30th of December, and after 6 weeks we have done on the left side. This procedure was done through direct anterior approach because he had significant muscle atrophy, disuse atrophy of his hip muscles. So I did not want to compromise further by going the conventional approach, so I took a direct anterior approach, and now he is recovering well. He is able to walk, he is able to sit, he is able to walk freely. Rather, he was able to walk with the abnormal gait earlier, and he is quite pleased and overjoyed with the overall progress till now.
He was, he couldn't walk when he was coming here, and now he's happily walking, and he thanking to the hospital and the doctor, who made him walk like he used to walk before 1986. We all thanking you for your help.